Well, mercury has been used in dentistry for over 200 years. Mercury is actually a material that's still used in America. It has been banned in the European Union as of February of 2025. 27 countries are choosing to stay away from it because they're linking it to different things, that we have better options, we have better materials now. And then if you have a mercury that's old and it has to be replaced, you have other options. Obviously, as a dentist, I don't want to deal with the mercury putting it in because I personally don't want to be exposed to it. When we remove it in a way that we feel protected with oxygen for ourselves. And for example, right now we have zirconia. Zirconia is a material that takes 1,200 pounds of force upon mastication. An average person chews at 200 pounds per square inch. So you're having people clenching at 500 pounds. So you have an option of material that is a lot stronger and is more cosmetic. A mercury filling, amalgam filling, or a silver filling must be removed safely. So how do we do that? We use the SMART protocol, and the SMART protocol entails in using airway. So we put oxygen on the patient. We completely cover the patient from head to toe, and we put barriers inside the mouth. So we protect the parotid gland, we protect the lips. We're going to use a rubber dam, we're going to seal that tooth, we're going to use some clasps, and then we're going to use a barrier. We're going to use suction, air suctions, special vacuums, and then we're going to use special diamond burrs that are going to cut that mercury into pieces. That's going to be done very safely with a lot of water. And then after that, when that is removed, then we start removing the decay. The decay is going to be removed with slow speed handpiece, and we're going to use colloidal silver, ozone, acid water, and we are going to use the laser to decontaminate the tooth at different settings, antibacterial, antiviral. Then we're going to repeat the process. We're going to use saline, colloidal silver, and these are all chemicals that are going to be removing and killing different kinds of microorganisms. Some people might have virus in the teeth. They might have parasite on the tooth. So different chemicals are going to be using different mechanisms to kill the actual microorganisms, being bacteria, virus, mold. So after that, we remove all the isolation, and the patient is going to be actually sedated for that, and the patient is going to have airway all throughout the process. The patient has the option to be sedated via oral sedation or IV sedation. I love sedation dentistry because it gives the patient the opportunity to be served without being anxious. We offer two kinds of sedations. Oral sedation consists in giving a patient an anxiolytic. We can do something like a Valium the night before, a triazolam the night before, and that's going to allow the patient to be relaxed and be able to sleep that night, so that way they don't come without having slept that night, because that also is going to affect how they're going to metabolize anesthesia. So we want to give them oral sedation also the morning of the treatment, and that way they can come relaxed. They can speak to us, we can speak to them, but triazolam causes amnesia. So they will not recall, but if they need to go to the bathroom or eat, they can communicate so. The other option of sedation that people associate with, like say, wisdom teeth extraction is the intravenous sedation. And I am a dental anesthesiologist. Our office is certified to do intravenous sedation, and that consists in either using fentanyl or midazolam or a combination of that. Some people would like to do surgical procedures with that, but the majority of the procedures in our office, I would say 99.9%, are done with oral sedation, because we have found that that's enough. But if somebody has some kind of trauma that they have not overcome and they're really, really scared, we also have the opportunity to offer intravenous sedation.